Hello, and welcome back to the Nourish with Purpose podcast. It's Bailey, and I hope you're having a great Wednesday or whenever you're listening to today's episode. Today's episode is full of a little spice. I'm honestly not hesitant to release it, but a little bit nervous just because I know there might be some varying opinions around what's talked about. So I just wanted to give an intro, kind of give my own view around medication and all the things and how I approach that with clients before I jump into today's episode. So on today's episode, I have Dr. Kourtney Chichilitti. She is a retired retail pharmacist and is now practicing as an integrative health pharmacist. So she worked in the retail pharmacy area for about 20 years. So I really trusted what she had to say. I knew she had a lot of life experience and would be a really good person to bring on to talk about something that I just don't have a lot of physiological knowledge on. I've never claimed to. I will never claim to also be able to take people off of medication with the work that I do, although I think everybody's goal for the most part, depending on what you're on, should be to live a life taking as minimal medications as possible. That is my personal view on that. However, when we talk about medication, we're talking about birth control. We are talking about Ozempic, semaglutides, Mounjaro, those brand names for the semaglutides, the weight loss medications. We're diving into that, talking about anxiety medication. I want to preface this with saying there is no judgment on my end if you take any of these. I have a lot of close friends that are on birth control. It's never something that I want you to feel ashamed telling me or talking to me about. I will say with the majority of people that I talk to around me that have been on birth control or are still on birth control, it has not come without negative side effects. That's just the truth, right? Maybe it's acne, maybe it's anxiety, maybe it's not really knowing like what their personality is without being on it and having that hormonal kind of like fill that you get every time you take the pill, right? It's just something that I have yet to see not give somebody at least one or more negative side effects. That's not to say there's not a place where some people, maybe it's recommended from their doctor that they take birth control, not just for preventing pregnancy, but if they have a bleeding disorder, then yes, of course, like being on birth control can help with that, right? To minimize the amount of bleeding you have. There are always going to be alternatives to getting on a medication, but for some people it just makes the most sense. And again, that never comes from a place of judgment on my part. And I really don't think that is what's conveyed in today's episode. But at the same time, because I take a different approach to healing my body, I've seen medication usage be really harmful for my own body personally when it came to kidney function. I've seen people around me be prescribed very loosely prescription pain medications, or also really be given only one option if they want to minimize pain from arthritis, which would be a drug that in most cases can cause cancer, right? Like, I shouldn't say that so boldly, but you know, sometimes I think we have to start questioning why negative things are happening when we're on a variety of different medications. And I don't believe that it's every doctor's goal to put you on every medication under the sun. There is no distrust that I have from them. I just know that that is what they were taught to do, is use medication to their benefit, right? Like, that is not a diss on Western medicine. And I never want to, it's hard because I'm going to offend people, right? Like, with what I do, I get a lot of judgment for what I do. I just don't want you to feel judged from what I do, like reflected back on you, I guess, in a sense of saying that. Really, this maybe doesn't even all need to be explained, but again, I just always like to cover my bases and let you know that if I was to ever work with you, I'm not ever trying to get you off of medication. I'm trying to help support your body in whatever phase of life you're at, whatever medication you're taking, just understanding that sometimes medication usage can prevent healing in certain areas when it comes to looking at the full picture, right? So things that you would always I just want you to be aware of, to have knowledge of. And if you're listening to this podcast, chances are you're not listening to, I don't know, learn about medication, or what I'm trying to say is you're probably trying to see an alternative route or an alternative solution. So hopefully this gives you a glimpse of that. And I just wanted to convey where I'm at on this. Again, there's no judgment from me. I just want to show a different perspective. And again, today's episode really does that. Okay, moving into how I am nourishing my mind, body, and spirit, along with like a little bit of a catch up. Today's episode might be a little bit longer in length, but I think that's okay. So how I am nourishing my mind is really, you guys are going to be like, yeah, Bailey, we can already guess, but waking up with the sun, not looking at my phone. This morning I got out for a walk, and it was so nice to wake up at around 7, make some breakfast with my husband, and then I went outside, did the chicken chores, and went for a walk. The chicken chores, honestly, sometimes it's like, ugh, I don't want to go out and do this, but it always kind of makes my day. If you don't know, right now we're raising 75 broilers, and then we have 13 laying hens and 3 ducks. Broilers are the chickens you butcher for meat. So we will be doing that in the second week of October, so that's already coming up. But yeah, it was just a good morning. Starting my day like that is so refreshing. A lot of my work today is in the afternoon. Not really, my work is kind of all day long, but a bulk of my calls are in the afternoon, so it's nice to take a little bit slower of a morning and just enjoy the crispness of the air outside. How I am nourishing my body. Oh, I made sourdough recently. I've not talked about that in a while. It's probably been about a month, honestly, since I made a legit sourdough loaf. I do sourdough pizza. I actually made a really delicious butternut squash pasta sauce and made pizza this last week with sourdough crust. I do sourdough tortillas. Like, I'm utilizing sourdough, but I haven't made a loaf. And something about pregnancy is that my body craves carbs, like bread-like carbs, in such a different way, which makes sense. When we look at energy, we know that carbs provide that. I've talked about the low-carb diet I went on and how my nails were super thin, my hair was falling out. I didn't feel like my skin had a lot of vibrance because my body was not getting enough energy from starchy carbs. So it's a food group you cannot completely eliminate. Really, yes, you can minimize it, but it always should be a part of a balanced plate, in my opinion. The amount will vary depending on health conditions, which I can obviously dive more into in future episodes. But when it comes to carbs, I've just been craving that. So having like a thick slice of sourdough with 2 eggs in the morning, and I'll usually do like 2 strips of bacon, and then a side of blueberries. Kind of varies sometimes, but that sourdough is truly just the best part of it. So good, it's so delicious. And so I would definitely say like diving into that, or not diving into that, but like integrating that back into my diet has been super good for my body. I've noticed that my body truly needs it. And I was talking to somebody else about that this weekend, and they were saying how when they were pregnant too, they noticed like their body just needed carbs, like those bread-like carbs, so much more, especially in like that second trimester, which is really interesting how our body kind of changes. And when you learn how to lean into the signals that your body is giving you or the symptoms, you start to recognize what it is asking for and how you can fulfill that. So that has been how I've been doing that. And how I'm nourishing my spirit is truly just with gratitude. I talked about that on the financial side of things last week, but I truly have just tried so hard the last couple of weeks to be genuinely grateful when even the smallest things happen. The smallest, not even small, sometimes like the biggest things, like having people sign up for my program, or having an evening that I can go for a walk with my husband, or having an evening where I can dance in the kitchen and listen to music and make supper very slowly. Like, it all just is something I'm so grateful for. And yesterday, truthfully, I was starting to spiral because there's just something that happened, and there's a trait about me that I don't love. I mean, there's going to be multiple traits, but one primarily is my sensitivity to not criticism. It's not criticism. My sensitivity to people disrespecting my knowledge. That is something I'm very prideful with. Like with what I know, with what I've learned, with the education I have, the investment that I've had in my education and continuing my education for the last 4 years after college, 3 or 4 years, I just lose track of time. I have invested so much time and energy into knowing what I know. And so to have people kind of discredit that, I think is where I get very offended, right? It's not the criticism piece. I can take criticism. I love when people ask me questions. I love when people maybe question why I'm doing what I'm doing. That doesn't hurt my feelings. When you talk down to me, that is what offends me. So anyway, there was a situation that happened, and I had truly had the last 2 days have probably been some of the best days of the year. Kind of going back to last week as well, just like truly the best days. Like I can't even explain like the joy and gratitude I felt on those days. And then when something happened in the evening, it was like, okay, I'm spiraling again. Like something happened, I'm spiraling. I need to get back to that point that I was at, because when I am on the tip of the roller coaster, right, the highest point of the roller coaster, I'm thriving. So I'm trying to create a balanced lifestyle that's a little less of a roller coaster and more like a trail. I mean, that would be wonderful, right? Like a highway rather than a roller coaster. Well, anyway, sometimes I find myself on the dip of the roller coaster. So trying to kind of like boost myself back up. And so gratitude was something yesterday. My husband's like, okay, what are you grateful for? What's gone well today? Because probably an hour and a half before this, I was telling him like, all the positive things that have happened in the last week, all the things I'm really proud of and excited about, and truly just thanking God for it all. That is 100% of where this gratitude is going. So he's like, okay, tell me what you're grateful for. And I was like, it's really hard right now. There's not a lot that I'm grateful for. And then when I thought about it, I just like was just spewing out the most small, random little things, but really that make the biggest impact. So gratitude, so big. If you're not implementing that. And I remember also having somebody tell me this probably in January of like when they noticed their life just start to like blossom is when they started praying and giving gratitude for what's happening. How many times am I going to say gratitude, by the way? But anyway, and I was like, yeah, okay, whatever. Like, sure. I believe it. Kinda, in a sense. It was so hard. Like my heart was so cold and bitter at that time. There had been some things that went wrong, things that weren't going perfectly for me. And so I was kind of cold to it. And now I'm like, I understand. So if you're kind of like, yeah, Bailey, whatever. Like we all know gratitude's important, whatever. Truly think about the smallest things and just thank God in the moment for them, because I really do believe it makes a huge difference. Okay, any other updates that I wanted to give you? I've had a lot of people ask about pregnancy, how I'm feeling. Truly am feeling really good. I am at a stage where, I'm in the second trimester and I just feel energized. I don't need a nap anymore. Like I've previously said, I had weeks like 6 through 9 that were pretty brutal, even up to maybe 10, just in the sense of feeling nauseous. And if I didn't eat when I needed to eat, I would throw up, which we don't need to talk about. But again, just things like that would happen if I wasn't being in tune with my body. But right now I feel very in tune with my body. I can recognize signals that I need food. I can recognize signals where I need more water or when I need, a quick energy carb. And it's truly made all the difference. I honestly too, now that I'm talking, which baby is the size of like a pear or an avocado at this point. In my mind, a pear is bigger than an avocado, but that's what my app says. So whatever, we trust it. But I can feel like flutters and some movement, definitely more on like the left side of my body, which is the weak side of my body. If you know about my back injuries, that is the side where it has a little, that's where most of my pain when my low back hurts comes from. So I'm like, this little stinker knows there's a deficit and just wants to hang out over there, but mostly only feel on my left side. But it's kind of fun to also just see your body change. And that's an episode I want to record separately, but how your body changes and how, as somebody who historically has been, pretty body obsessed, shamefully, I say that, right? Obsessed with physical appearance, not in the sense of like my face or wearing makeup or hair, but more of like, what does my core look like? What do my legs look like? Do my arms look flabby? Like things like that that I would very critically look at on my body, to now know my body's changing and have absolutely no control over that. It's pretty wild. And so how I'm supporting my body nutritionally, but exercise wise, and also just how my mindset is around my body right now during pregnancy is something I'll definitely record a full episode on, because I feel like I've been through a lot of highs and lows when it comes to my relationship with food, and to now be able to look at food as such a tool for support it's an amazing point to be at. It's a point that I've talked about this in the past, but I've spent 2+ years preparing my body for pregnancy. I think when we see somebody get pregnant, for some people, yeah, it's like, oh, they made the decision, they're doing it. For me, I spent years preparing my body for this moment, mentally, physically. If I would have gotten pregnant right after getting married, it would not have been good. I do not think it would have honestly happened, because I didn't have regular periods. I lost my period for 6 months. I was super stressed. I thought that I had leaky gut. I had horrible, I don't even know. I was really going through it, truthfully, in every sense of the word. So it wouldn't have been ready. And I knew at that time when I lost my period, it was kind of like that signal of like, okay, yeah, we know you're not eating enough. You're over exercising. You thought it was getting better, and it's actually not. It's a facade. So we need to make some changes. And so all of that to say, I'm doing well. Baby's doing well. I'm doing really good mentally and physically. And again, I don't say that because it's been easy. I say that because it's been years of preparation, and just something I want to acknowledge, so that if whatever stage of life you're at, or if you're maybe struggling with getting pregnant, or maybe getting pregnant was super easy for you, just know like there are people on all ends of the spectrum. There's people in the middle. There's people that maybe you're not even wanting to have a baby for years, but you're already thinking about it. I think that's just something I like to reassure, is that for a lot of people, it's not a fast deal. Maybe it's not even something you're thinking about or trying to do, is have a child, but at the same time, preparing your body, I think, is always important. So all of that to say, a long catch up this morning. I guess for you, it's probably not morning. Maybe it is, but I'm recording this in the morning. So we will jump into today's episode. I'm going to give you a brief summary of Dr. Kourtney, and we will jump right into the episode. So she, like I said, is now a retired retail pharmacist who is practicing as an integrative health pharmacist. She works with individuals to uncover the root cause of their chronic illness and improve their health and lives without the primary use of prescription medication. Again, I wanted to preface this episode by saying that the information given during this episode is not intended for you directly. Please contact your primary care doctor before stopping a medication or trying an alternative route. But I really just wanted to have somebody on the podcast to open up the conversation about medication, because it's something I know I'm not qualified to talk about, never would claim to be, and I know a lot of people have various opinions on it. I really love her usage of functional labs to see if there's any underlying cause before jumping into medication or antibiotic usage. And, really with pills sometimes being commonly given or freely given out these days, I truly just wanted more insight on the world of pharmacy in general. And I felt like she was the perfect person to do that. All right. So Dr. Kourtney will share all about her story and more. So with that, let's jump into today's episode. Dr. Kourtney, thank you so much for being here.
Thank you so much for having me, Bailey. I'm so excited.
Good. I want to really go back to kind of not the beginning, but kind of the beginning of your interest in pharmacy and being a pharmacist. When did that start, and kind of what led you to pursue that doctorate degree in it?
So, like most 18-year-olds in high school trying to pick what you want to go to college for, I was actually a nursing major. I was going to go to nursing school, and right before I started, I had everything lined up. I had a full scholarship to nursing program. I was like, all right, I volunteered, and I was like, I can't do this. So ironically enough, I was a nursing school dropout before I started, and I was an accounting major for a year. then I knew I really couldn't do that. So when I went back into my advisor at school, we just kind of talked about the different options. And, everything that I wanted to do was like 6 years plus. And I knew I wanted to do something in the healthcare field. And, we kind of labeled it down to a couple things. And pharmacy just seemed like a really great option because there were just I didn't have to make my mind up what I wanted to do right then and there at 19 years old. I could have taken it down any angle, retail, hospital, industry, so there was options and I thought, you know what? I'll figure it out as I go. Let me see what interests there are, like what areas interest me the most and, so I kind of just started there and at the time when I graduated from pharmacy school, I think the year before me, they made it mandatory in Pennsylvania that you had to get your doctorate. So you could choose before that to do a 5-year program and get your bachelor's or do the full 6 years for your PharmD, which is your doctorate of pharmacy. So that's kind of where I started and figured, all right, well, as I go, I'll figure out what I want to do.
Mhm. Mhm. That's so interesting you started the nursing route because I'm very similar. I actually went to like a intro to nursing. It was like an event and I'm like, yeah, this is not for me. Like I really thought everything about nursing aligned and then I got there and I was like, I don't think I could handle the stress. Oh my gosh. Okay, so with pharmacy, what are the different routes? I guess you had mentioned there's different avenues you can take that. What would that look like?
So for me, I mean, at different stages in my career, I never was involved in industry or hospital. The last year of school, we have clinical rotations. So we basically have an entire year where we go to the different aspects and see. So you go to a doctor's office and make rounds with the med students. Same thing in the hospitals. You can go to the inpatient hospital pharmacy and the outpatient where you're on the floor working with all of the, medical interns and really diving into patient cases. And then there's, of course, retail and there's industry and there's long-term care where you're working on the back end of things or looking at home infusion. So there's so many different ways to go. In my career, I started out in retail. I was always a retail girl all through school. That was my jam. I was just like, I loved that busy, hectic pace, and I thrived in it. So I did that my entire schooling, my career in schooling as an intern. And then when I graduated, I went right into the company that I was working for. So it was corporate. And when I got pregnant with my son, I knew that same lifestyle, working 14-hour shifts 3 days a week, was not going to work for me. And I was really blessed that I was able to get a job with mail order pharmacy. So I worked from home and I was verifying scripts without the drugs and looking for drug interactions and doing the, back end stuff, but without doing it on the front line. So, it was kind of boring. It was a numbers game. It was very much like I've got to verify almost 200 scripts an hour. It was plugging through. It was crazy. It was not ideal, but for me, it was perfect to be a stay-at-home mom for my son and just kind of balance the two. And then my career kind of shifted into mom and pop pharmacy as my son got older is when I really kind of found my true balance getting into mom and pop pharmacy because it was not that corporate policy where it enabled me to really get involved with my patients and kind of how my business was born.
Yeah, well, because you did retail pharmacy for 20 years, right? Is that correct? Or around 20 years?
Pretty much. When I did the 7 years of mail order, it was like retail. I still kind of filled in for retail, like I did, here and there, but I worked from home for 7 years in a stretch, but it was doing kind of the same thing as retail. It's just not having the physical drug working from home. It was just doing, what I did with the verifying and looking at drug interactions, calling patients, doctors, that kind of thing, but without the actual physical presence of the drugs.
Okay, and I think that's the piece that I find so interesting is because you recently retired in a sense. I saw you had posted that. I'm like, yeah, that is, I mean, essentially, into now more of like an integrative functional medicine route. You started your own business. So, what kind of led that transition into something different? Kind of on, in my eyes, like almost the opposite end of the spectrum.
100%. So it was my own health. So, in the midst of all of that, when I was probably in my early days of pharmacy school, maybe 1920, I suffered from anxiety. And back then, I really didn't know what it was. I would get these little blurbs of palpitations, numb hands and feet, shortness of breath. They would last for 30, 60 seconds. Okay, I'd breathe through it, no big deal. When it became that I was getting that 5 or 10 times a day, and I went to the doctor and was like, what's wrong with me? that was when I kind of was like, okay, was put on an SSRI, which is an antidepressant, and that took the panic attacks away. So I was like, okay. So when I was trying to get pregnant with my son, I stopped taking it and I was okay. I had those little blurbs, but I was able to breathe through it, no big deal. And then when he was a baby, we were driving one day, came right back, and I'm like, oh, heck no, I'm driving. No, my baby's in the car. I'm feeling like I'm going to faint or something. Like, no. So I went right back to get back on medication. And, with the exception with when I was pregnant with him for 16 years, I was on an antidepressant that controlled these little blurbs of panic. So when I went back into pharmacy after my son was older and I went back into mom and pop pharmacy, it was there that I was starting to dive into things. So one day I was in the pharmacy and there was a box on the shelf. And I actually talk about this in a book I co-authored about like how this came to be. And there was a box on the shelf. And I remember asking the owner of the pharmacy, I was like, what's in this box? It's cannabis. There's these cannabis products in here. And I'm like, what? And this is like, remind you, like, this is like almost 10 years ago when like it wasn't a mainstream thing where CBD is accessible. It was kind of like new. So it was right when it was like, he was like, well, it's up and coming. I was at this independent pharmacy convention and for pain and sleep and anxiety. And he looked at me because he knew I was constantly trying to get off of the antidepressant for my anxiety. And every time I did without fail, these panic attacks would come back full force. So I was like, okay. So I dove into the box. I started researching. I started trying the products. And literally in 1 week, I tapered myself off of my antidepressant. Now, I wouldn't recommend that to other people, just FYI. But I was so fixated on getting off of it because I didn't like the side effects that I was feeling. And I knew that it was changing me as a person. And I dove in and I never looked back. And then more recently, learning that kind of opened my eyes to natural, remedies for things. So I started to really dive into the gut microbiome and probiotics. And I started to look at drug nutrient depletion, which is so super duper real. We could do a podcast just on that, looking at how many medications, what they do to your body and what they deplete and how you have to, if it's necessary that you're on a prescription, replenish these things. So I started to dive into that and started working one-on-one with my clients. I started teaching classes every month. We did Let's Talk Hemp. And back then, nobody knew about CBD. So it really drew a crowd in. And I just kind of became known as actually the wellness pharma chick was like my page that I had. And everybody would come into the pharmacy and it just became like my little thing. And here we are 10 years later. It's my full-time job.
Oh my gosh. I think that's amazing too, just like the progression of it, like how, and I always love when people have their own personal experiences, right? With having anxiety and being on antidepressants, and then you found a whole nother route of treatment for that in a sense. And so is that primarily then what you're doing with clients, is working with people to get off of antidepressants, or do you open that up to all different types of medication? What does that look like?
So I want to preface for anybody listening to, I never shame anybody for being on a prescription medication, especially an antidepressant. I always meet my clients where they are in their journey. So usually it's not always getting people off medications. Sometimes people want to support what they're doing if they're on medications. And a lot of times they don't understand. So a lot of times it's me helping them understand what the prescription medications are doing, the good things and the bad things, and weighing risk versus benefit depending on what they're on the medication for. So for me, I look at it like if they want to come off of a medication, we can safely get them off. And I make sure they let their doctor know and that it's, I don't want to take them off of something and they have to keep that, connection going with all of their practitioners. So we can absolutely get off of medications, but usually that's not the reason people come to me. A lot of times we dive into different labs and we look at not the standard traditional labs that, people go and get from the doctor, but we dive in a little deeper and we look for things like nutrient deficiencies, and we look at the gut microbiome and imbalances of different bacteria and the presence of different viruses and parasites and heavy metals and mold and all of these things that just aren't mainstream topic in Western medicine, but they're responsible for so many things that people are feeling. So it's like more of an education. It's helping people with lifestyle. It's helping people with detox and replenishment, and really taking a whole approach to the body, and not just where in Western medicine, maybe they're going to a cardiologist or a pulmonologist and treating one symptom at a time, where, I'm kind of marrying my background in pharmacy with my functional background and looking at it from, okay, maybe you need to be on a prescription, or maybe you need to be on it for a little while until we balance things out and find out the root cause of what's going on, instead of slapping the prescription band-aid on it. Because, far too more often when I'm in the pharmacy, it's like somebody comes in just like myself. They come in and they're on a prescription, for an antidepressant, and then their sleep is messed up, and then they're gaining weight, and then their libido's down, and it's like this cycle. And then the next thing a year later, they're on 4 or 5 prescriptions, and it's like, how did this happen? Like, how did and they still don't feel good. They're still coming in and saying, I have anxiety, I have brain fog, I have weight gain, chronic fatigue, all these things that are so real, but they're just not addressed in Western medicine. So I really dive into that with people, and just help them get to the root and feel good, age in reverse.
Yeah. Oh, I love that so much. And I feel like that is something that I notice too with clients. And I never, like you said, which you have much more authority to talk about medication with clients, but I'm like, I'm never trying to get you off of it, but how can we support your body if you're on it? Right? Because, yeah, like you said, there's so many negative side effects that aren't always talked about, or they're like, I started taking this, like now why is my hair falling out? Or why do I have acne? And it's difficult when you're kind of going against, like they're taking something consistently every single day because there's maybe a need, but then at the same time, their body's negatively responding to it. So that balance it's hard, but I love that you take, of course, that root cause approach. I just so firmly believe in that. And labs are the perfect way to do that. I just started offering labs, and I feel like my whole world has been opened. I was like,
Right?
like, yeah, there's so much you can do when you talk to somebody and you have a conversation, but to have that foundation, it's like just a whole new set of, yeah, of tools to look at to help support them. So I love that you use that.
Yeah, no, it's great. It's hard, and labs are not the end all be all. There's some things that don't labs don't do justice, but a lot of times it points us in the direction, or it's just kind of like a map, like you see something, you're like, well, that makes total sense why you're feeling this way. And sometimes it's a mystery. Sometimes we have to dive in and really see like what's going on, and really take listening to somebody. People don't get listened to in Western medicine. They have 7 minutes per insurance to tell their doctor what they're feeling, walk out with a prescription, and from beginning to end. And it's like sometimes just listening, and when you just listen to somebody and listen to their subjective story and combine it with all of the other things, it makes sense. And that's what I think is lacking, and so many people need that in their health and wellness journeys.
Oh yeah. And yeah, I know the time that you probably sit down with clients. For me, it's like about an hour in that first call to like truly listen to what has been going on in their child, like their history from childhood of like what type of environment did you live in, and like it all plays such a factor. Yeah, it's just so fun to be able to connect the dots, right, and to hopefully give people answers to what's going on. But I know you mentioned too the negative side effects that aren't always talked about when it comes to medication. So I was thinking we could talk. There's about 3 that I have in mind that we could talk about. Learn more about what the negative side effects are, and then how maybe you would approach an alternative, or even approach like supporting your body in combination with that medication. Okay. So the first one I want to talk about is birth control, because I think I feel like the negatives of birth control are being talked about more, but I would love for you to expand on like what the negatives of it are, and just kind of, yeah, educate us on that front.
All right. Well, first of all, I'm gonna age myself here, Bailey. I'm gonna age myself. I'm gonna talk about when I was 15 and I was diagnosed with endometriosis. So this was a very long time ago. This was almost 30 years ago. And this is where my anxiety, I truly believe, came from, this panic attack disorder, being on birth control pills from when I was 15 years old, on and off, because they couldn't regulate my cycle. They couldn't regulate my pain that I was having. It was an ongoing battle. I've had surgeries, and even down until when I turned 40 and they wanted to give me a full hysterectomy, but that wouldn't work. That was when I really started to even dive into my own business and really kind of open things up a bit. But when you're on birth control pills, nutrient deficiency is like, sure, somebody's coming in to pick up a birth control pill at the pharmacy. They don't probably want to hear my whole spiel on it, but okay, maybe we'll give them something like some B vitamins, a good multivitamin to replenish some of the stuff that's being lost there. But on a whole, when we look at birth control pills, they are really, you're putting these synthetic things in your body and canceling out what your body is naturally trying to do. And it's so unhealthy that it affects every other hormone in your body. Our hormones, just like the systems in our body, like we were saying, like a cardiologist, a pulmonologist, you can't just single out one system in your body. So when you try to control your hormones with synthetic products and to try to mimic your body, basically you're affecting your adrenal function. So that's your cortisol, your stress hormone, from anything from your sleep patterns to your weight to your anxiety. That has the potential of being off. Looking at your thyroid function and what's going on there. And that same thing, all of the same things of weight, mood, anxiety, all of these things, again, that aren't talked about in Western medicine. Looking at your insulin levels and what's happening there, why so many people are getting diagnosed with diabetes, type 2 diabetes, whether they're overweight or not. It's scary. It's frightening to see the amount of people that are getting put on medications or told that they have diabetes. And it's just a cycle that goes on and on and on. So you can't just single out the sex hormones and say, I'm going to take this for this and think that nothing else is going to go wrong in your body. And I truly believe it's like an epidemic, that it's not a strange thing that all these girls that are put on different forms of birth control, and it doesn't matter whether it's a pill, a patch, an insertable, whatever you want to call it, and good, it's not. And it's affecting people in terrible ways. And I think anxiety and mental health is the biggest factor. And it's a crisis in our country. And it's really sad. And we need to bring more awareness to it.
Yeah, well, I even remember when I had gone in, this was, yeah, a little bit before I had got married. This was 3 years ago. I went in with the intention of like, I don't want to get on birth control, but I just need some education around like, how can we prevent having a baby, right? And I was there for maybe 30 minutes, and by the end of the 30 minutes, there was a prescription called in for birth control. And I remember then we went on our honeymoon, and my attitude was horrible. I was exhausted. I would go to bed at like 7 o'clock. I was so rude. Like, I did not feel like the same person at all. And I always tell my husband, I'm like, we need a second honeymoon, because I was like crazy. Like, I truly felt crazy. I'm like, that was so unfair, because you just don't expect that. When you go in not wanting something and then you get on it and then your body responds like that. I think for me, it made me so much more passionate about like what is this doing to everyone that's on it? And I think for everyone, like you said, it shows up a little bit differently. But I would agree, it's more of like the mood, the mental health side of things that I feel like is being so impacted, and women don't really know why, maybe even. Like, they don't know that it could be related to the birth control that they're on.
No. And I mean, I was in the field and was on this for literally, even when I was later on in life, when I started dabbling more in the natural, ways, it was an ongoing battle for me with my endometriosis. When I felt pain, every time I go back to the doctor, that was the only answer that they had for me. And it was like, okay, here we go again. Okay, let's try to suppress your period and take it consistently so that you don't have a cycle and it's not terrible and you're not bleeding so heavy and all of these things. But then when we take it back a couple notches, it's kind of like, I remember at one point I was going to the top fertility specialist in University of Pennsylvania. I remember I had seen, I can't even tell you how many different routes that I took. And this was at a time of my life where I wasn't trying to get pregnant, right? Endometriosis is like an infertility thing. So when you go to get treated by it, you go to an infertility doctor. So at this point, I wasn't even married, and I was going to infertility doctors to get my endometriosis taken care of. And I remember the one doctor, he literally said to me at the appointment, oh, the way to handle this is to get pregnant every 9 months. And then told me that endometriosis grows off of estrogen. And I don't understand these doctors that put girls on birth control pills. But after he did his little procedure and whatever, and I was still feeling the same way, guess what he did? He put me on birth control pills. The same man who said to me a couple months before, I don't understand why doctors give girls with endometriosis birth control pills, because it literally feeds the endometriosis. So it's just a terrible cycle. And like you said, you don't know if you don't know. And it's become such a major, it doesn't affect anything. It's so commonly that they're given out. There's no side effects, or people will say the side effects, but it's like, oh, well, that's normal. Just like when we talk about menopause, we can go down that rabbit hole. Oh, it's normal to feel this way and have weight gain pain and hot flashes and all these things. No, it's not normal. It's not. We don't have to feel this way.
Mhm. And I think that's the challenging part too is, and I always try to give the benefit of doubt here too. Like doctors weren't trained to know maybe vitamin or mineral deficiencies and how to supplement or even nutritionally. Like they weren't taught that. So it's hard because they go towards what they were taught. You know, out of respect for that, like, yeah, they're doing what they were taught, but when you see the other side of it, it's like, but there has to be something else instead of just taking a pill. So like let's think that if somebody's on birth control, maybe they've been on it since they were 15 and they're now in their mid 20s. How would you recommend, even if they're like, I don't know if I'm going to get off of it, that they could support their body still while being on it if they're not sure if they want to get off?
I mean, it's kind of a catch 22. It's like, in my opinion, I think it's like, it's almost like false hope. I feel like you're putting something in and you're repetitively creating a storm. You're creating a storm with your hormones. You're creating a hormonal imbalance storm, and you're not letting your body do what it's supposed to do to the point where, like you just said, it can affect your personality. So to support your body physically, doing things like multivitamin, B vitamins, taking adaptogenic herbs to kind of help balance your adrenals so that your adrenals and your thyroid are functioning properly, making sure that you're eating good, clean, whole foods and trying to eliminate toxins, drinking good water, air purifiers, all of the things to help balance out the things, all of the oxidative stressors in our life, physical, emotional, all of the things we come in contact with. So, trying to help create a balance there is always important. But it's almost like there has to be a better way, but it's hard because there's not, with the exception of just physically doing things to prevent birth control versus taking things synthetically or in the body. It's a really hard balance.
Yeah, yeah, it's kind of, yeah, when you were saying that, I was thinking like, oh yeah, it's if a client would come to me with joint pain and be like, but I'm still eating out every single day, but I'm taking all these supplements, so like I should be fine. You can't really win in that situation if you're going to continue to do something that is maybe causing issues in another area of your body.
Emotional, physical stress, all of these things affect the gut microbiome. Any kind of medication disrupts the gut microbiome. So when that happens, we're affecting things. 80% of your immune system lives in the gut. So right off the bat, when you're doing these things, you need to do other things to support your immune system, support your mental health and wellness, support your gut overall, your GI health in general.
Yeah, and I want to emphasize like if you're on an antibiotic, take a probiotic. I just remember like that was never talked about until I started looking into integrative health. Like I would go to the doctor because I kind of felt gross, but like I would have really been fine. Like something I would have pushed through now. But in high school, it was like, well, could you just put me on an antibiotic? No idea that there was any correlation with the gut. So and I still don't think people know that really. So like wanted to really emphasize that because it's so important. Like you said, daily. If you're not doing daily, at least when you're on that antibiotic. Yeah. So
Yeah. I think doctors are starting to get a little bit privy to that, where a lot of times people will come in and say they're on an antibiotic, their doctor told them to take a probiotic, if we remind them and they say, okay. So I think it's becoming a little bit more mainstream. Like you said, everybody's kind of talking gut health, but what does it really mean?
yes.
You
Yeah.
know?
Yes. Exactly. So the next one I wanted to jump into was the semaglutides like Ozempic and Mounjaro because this is a very hot topic. It's a little controversial depending on maybe your view of it. But I was just curious, like, what are the negatives? What do you believe are maybe some positives, if any? Yeah, and just kind of open up that conversation.
So it's it's a rough conversation because I can tell you all the bad things and I can tell you what I saw. We had a program at the pharmacy that we did the compounded version, the generic, because the brand was really hard to get. Insurance companies were not covering it, or if they were, we were losing money. It was a big problem. So we started doing a compounded form of it, and it made me cringe. It made me cringe every day because some of the people that would come in, and do I think that it could be a helpful drug for some people? Yes. But when I saw how it was being used by people that maybe were 5, 10 pounds overweight, and what it's doing to their gut, like what it's doing, and even people that were on it for diabetes on the brand for the past, 2 years and are coming in with symptoms where they're constipated, they have reflux, and now they're taking medications for both of those, and they're still not feeling good, and their guts off, and they're chronically constipated, and they're taking now proton pump inhibitors, which are, I can't even talk about how terrible they are. If I had one drug to get out of the world, it would probably be those. But like, it's starting to see those side effects circle around with people from the people that have been on it longer. I can't even say the people that are just using it because it's a quick and easy way to lose weight, what the ramifications are going to be, the lawsuits that are going to be happening, that, I don't even know. But again, I do think that it can be a helpful drug for people that maybe are chronically obese, to help them start to help their body balance. I think that there's other ways to work on those GLP receptors in the body without doing an injectable that can cause other things. It's very kind of like a loaded topic, but I feel like in the pharmacy, for all intents and purposes, most of the time when we dispensed it, it was people that I felt like I wish that they could dive into some functional stuff and find the root cause of what's going on, instead of kind of slapping that on and them still going to be having inflammation in their body and all of these other things that maybe they might look good because they're skinnier, but in the long run, they're literally like, when your body is not absorbing nutrients, when you're literally causing something to make your body feel full or throw up when you eat food, or it's literally the drug slows your gastric motility down, and you're not absorbing your minerals and nutrients that you need, other things are going to start happening. So people are going to be chronically aging in reverse, like they're chronically aging at super duper speed. They're going to be like, they're like people's hair falling out in clumps. Like, I've seen that. People's skin just like aging quickly, wrinkles, when you're not taking your nutrients in, hair, skin, nails, your organs that need these nutrients to function properly, all of these things, if you're not sleeping right, if you're not doing all of the things right. So this is where I think nutrient depletion is the biggest problem with it, and people are not seeing the immediate results of that. They're seeing the weight loss and they're like, oh, this is great, but they're not realizing that they're depriving their body of what it needs to survive and function properly. And people are going to start seeing bigger things. Okay, yeah, they might not, okay, aging with skin, but like, what about their bones and muscles? It's literally taking the fat from their muscles. It's literally breaking down their muscles. This is the first place it takes the weight from. And then what's that doing when your bones, like you're going to have crazy osteoporosis and osteomyelitis and all these things that are going to start happening to people with long-term use. So it's a cringe topic for me, and I don't think it's bad for everybody, but I think that we're going to see problems. There's going to be problems from it. People, when they're aging, and they're going to be like, why am I aging so super fast at this point? But
Yeah. Well, and that's where I really struggle with it too, is because you see like the muscle mass deterioration, and the people, I will not say like, oh, everybody taking it is not doing these things, but I would say for the most part, I don't see a lot of people really changing diet too much or increasing exercise to build muscle mass while it's deteriorating, right, due to nutrient deficiencies. And so that's a really challenging thing to see. And I also think, I mean, I do a lot with women in their relationship with food. And so it's like, well, that relationship with food is also never really being healed if that was an issue for overeating or now undereating. And so how are you going to everybody wants, I shouldn't say everybody, a lot of people want to be like, oh, you look so skinny. And I know some people that are on it, and that's like the best compliment of like, oh, you look so skinny. Like, as a society, I think we have to change how we approach even talking to people when we see they've lost weight. Like, that's what's so almost difficult for me to see, because their relationship with food and their body is never actually healing either, just because they're losing the weight.
100%. And I love that you just said that, because I think that's one of the biggest things that centers around weight loss. Like, there's so many different factors, and I can even just say my weight over the years, and I can give you examples and dive in, but just for all intents and purposes, to sum it up, if your somatic nervous system, if your nervous system is dysregulated from stress in your life, you're going to hold on to the weight. You can do all the workouts, you can do all of the things, like I see it all the time with people that are doing HIIT training or runners, and they're like, why can't I get rid of this 10 pounds of belly fat? Well, because you're jacking up your cortisol every time you do those workouts. And I love those workouts, but I have to do them. It depends what else is going on in my life when I do those workouts, because it can hurt me or it can help me depending on what's going on. But even taking it back to what you said about people's relationship with food, that's huge, and it's that ties in with the nervous system, right? So if people have had issues in the past or when they were younger, eating disorders, different things where it's not healing from that, and that's really the true way to heal and lose weight. I always tell people that are trying to lose weight, I never talk about diets. It's always nutrition and lifestyle, and I'm sure that's what you do. You know the drill. It's not about a diet, it's about a lifestyle, it's about nutrition, and it's about feeling good about all of the things on your plate, not just food, your spirituality, your creativity, your relationships, your job, all of the things that affect who you are as a person. It's so important. And I think that if you try to heal one thing, it's just maybe you might feel good for a little bit because the weight's coming off. But in general, it's going to come right back if you're not healing those other things, especially your relationship with food.
But I'm sure it's so hard to work at a pharmacy too and maybe see all the different medications that people are being prescribed and having to fill them. Like your job is to, right? Like fill the request for the medication. Like there's not a lot you can really intervene with there because you're just doing what you're told. So how did you handle that when you were in that environment? Was that difficult these later years?
And exactly that. It kind of got worse as I went on. So, I feel like I kind of call myself an integrative health pharmacist because I wouldn't be able to help people in the capacity that I do without my knowledge, understanding, and experience that I've had in the past 20 plus years being in pharmacy. But when I look at, my practice over the years and how I was more integrative when I first started, and now how I don't know the right word. I don't want to say less tolerant because I feel like I always meet my clients, my one-on-one clients in my business. I always meet them where they're at. So like if somebody's on prescription medication, wants to get off, I can help them. If they want to stay on it and still get help with XYZ, I support them wherever they are in their journey. But when I was in the pharmacy, it was kind of like, you had to learn when to hold them and fold them. So a lot of times people wanted me to work at their pharmacies because I was like upselling supplements and like, oh my gosh, hey, if you're on a statin, you need to be on CoQ10. If you're on an antibiotic, you need to be on a probiotic. You need to take XYZ while you're doing this. So it was like, I took that very seriously, and I wanted all of my patients to know this. And there was the people that really appreciated that conversation when they would come to pick up these meds. And I would say, you really need to be on this because this is what's happening. And I would explain it to them. And some people loved that. And some people would complain that I was aggressively trying to sell them supplements. And it's like, okay, either way, I care for each and every one of my patients. And it's about their health and wellness and wanting them to thrive. So I feel like that part of it was very hard because it was like, people would ask for supplement help and then I'd go to give them supplement help, but they really just wanted me to tell them what they wanted to hear on most occasions. So it kind of became very hard in that sense. And it also just became very hard just giving the prescriptions out to the point of like, when I knew there's a better way, when I would see people and then I'd see them getting on different meds and different agents and something for sleep and something for weight, and just being like, gosh, I wish you could dive in and really just, if I could explain this to you and give me 10 minutes and I can explain to you what's going on in your body and how to heal it and feel your best and not just keep slapping these prescription band-aids on, you'd be better off. But sometimes, depending where people are in their own journey in life, is that something that's viable, affordable? I think it became very, very challenging. It just was not in alignment with what I wanted to do. And yes, it was very challenging, which brought me to just be like, I'm done.
That's the beauty too of having your own business and being able to do what you believe is people come to you because they probably align with something you're saying, right? They're not there to disagree with maybe taking something in conjunction with a medication, like they're coming to you because they know now your functional medicine first, and then you will see how you can work with them if they're on medications, of course. But I think that's the beauty of it, because now, yeah, it's your choice. Like if somebody doesn't align with what you're talking about, like you're not fit to work together. And there's the beauty in being able to kind of differentiate like who's intended to work with you and then who maybe still does not agree with what you're telling them to do. There's another question about kind of how we approach this now moving forward that I was very interested to see what you would recommend. is if we're going to go to the doctor and we have whatever issue it is, and their first kind of suggestion is to get on a medication, how would you approach that environment, knowing maybe you don't want to get on a medication or you want to find an alternative route? Maybe you wouldn't find yourself in that environment anyway, right? But how can we better educate ourselves on the medications that are being recommended to us? Do you have any like resources or any ideas around that?
I mean, I feel like you 100% have to be an advocate for yourself. You have to be an advocate for your elderly parents, grandparents, because it's just unfortunately, our medical system, our healthcare system is mandated by insurance companies and it's all about money. And I saw it firsthand. That was the second reason why I left pharmacy, when I have to lie to people and tell them we don't have drugs in stock and they're on back order because we literally lose $150 on a medication giving it to somebody. And that just broke my heart. Like every day I felt so cringy. And I feel like people don't know. People don't know these big conglomerates that are out there, how detrimental they are to their health, their parents' health, all of these things, because it's a system. This is what's happening over and over and over again in Western medicine. And people are just doing what their doctors tell them. And the doctors are just doing what the system tells them, because there's a lot of great doctors out there that are just victim to, okay, I get 7 minutes with my patients. Okay, talk fast. Okay, here, wait, we're going to do this. Okay, here's your script, blah, blah, blah.
Yeah. Oh, yeah. And like you said, there's great doctors out there. And I love to always say that because there are, but they're doing what they were taught to do. Same with like the drug reps that will come in and talk to them. Like, well, think about the incentives if you give this out. Like, it's just really difficult to see. I think when you see the both sides so clearly, it's really difficult to go back to that environment, or like you said, even to work in that environment. I worked at the hospital in cardiac and pulmonary rehab for short amount of time, but that was even difficult for me nutritionally, what they were telling people to do. So I can totally understand how, for you being in that environment for 20 around 20 years, like how much that would have, yeah, been difficult and kind of worn on you too when you see that every single day. Well, and correct me if I'm wrong, but I feel like even historically, like when people started to maybe find alternative forms, like to treat something, right? It was mostly like herbal based, wasn't it? And then they made drugs to kind of mimic the same effects of the herbs. So it's
Yeah.
really interesting how like disconnected it is now, because at the foundation, like it really was meant to be like herbs used to do XYZ, not a pill that now they can mass produce and do XYZ with it.
100%. And it's, yes. So there's so many supplements. I think one time I put a post on social media and was like, I'll go first, like what drug, and like basically like the root of the drug. And I think I did red yeast rice for cholesterol. That's a statin. It works the same way that a statin drug does. So imagine if big pharma wasn't, and we were looking at what our earth gives us and how to use these things for our health and wellness.
Oh, yeah. Yeah. And that's something I feel like we could dive into in its own separate podcast. So many of these things, it's like, oh, we should really wait. We don't have the time to really dive into that, but we could. So on this podcast, we talk a lot about our purpose and how it's not necessarily linked to a specific job or role, but instead it's those characteristics that you possess that allow you to live a meaningful life. So, Kourtney, what would you say is your purpose?
I feel like my experiences that I've had, and I've had a lot of them in my 44 years on this planet, a lot of those experiences have given me the empathy and compassion for people. So when it comes to being in healthcare, you can go through the motions and you can be a pharmacist and throw out, prescriptions to people. You can be a nurse and go through the motions, but really truly being able to make an impact from somebody, and somebody, even something as simple from back in the day, walking down the cold and cough aisle with a scared mom of a new baby and just giving them reassurance of, here's what to do. If this isn't working, check and do this, and just giving them a security, and giving them, just a person to lean on and somebody to help them and guide them. It just that's always been my passion, just helping people. I know it sounds like very cheesy, but it's very much like when you do that at the end of the day, walking out every night and knowing that I've made a good impact in the world and that I've changed things and people's health for the better.
Yeah. Oh, I love that. And your passion, like I can just hear in your voice, and like your empathy and your drive to truly like make a difference is so present. So thank you. That was an incredible answer. And thank you so much for being on today's podcast. I would love for you to share your socials. Like, how can people get connected with you, find you? I know you have a podcast. Share about that as well.
Yes, so I am on Instagram as Dr. Kourtney Chichilitti and Facebook Kourtney Powers Chichilitti. It's Chichilitti. As me and Bailey were talking before. My podcast is called Balanced Wellness Solutions, and that's on all of the main platforms, Spotify, Apple. Bailey, you will have to be on too on my podcast. I loved our conversation today, so I can't wait to have you on as well.
Yes, I would love that. Well, Kourtney, thank you so much for being here.
Thank you so much for having me, Bailey.
All right, so like I mentioned, of course, this episode was full of a lot of information. I just hope that you are leaving feeling encouraged and inspired, not overwhelmed or discouraged, because truly everybody's health journey looks different, and the route that you take towards healing is going to look different for you. If you stuck around this long in the podcast, I just wanted to share with you that I am launching my Rebuild program. It's actually kind of launched, but not publicly, and spots are already half full. So that is an incredible blessing, something I'm super just excited for those women in that group. It's one-on-one coaching, but the ones that are starting in this October launch date. If you are interested, all of the information will be in the description of today's episode to join that program, or at least join the wait list to then inquire, get a one-on-one call scheduled with me to talk all the details, most importantly, to learn about you. So with that, if you're interested in following along with my life outside of the podcast, you can find me at Nourish with Bailey on Instagram, TikTok, Lemonade, YouTube. You know the drill by now. Most active on Instagram. So if you're interested in connecting with me, feel free to do it there, or my email is always in the description of each episode. So with that, I'll talk to you again next Wednesday. Bye.